Thank you very much. First, I would like to say it's a great pleasure and great honor to be here. Thank you for IHE-Europe, also for IHE France, Intereurope Santé, to organize this session and this connectathon. I would like to speak about the latest development of eHealth in France. Who am I? I'm Thierry Dart. I'm a medical doctor, so I'm not a technical guy, sorry. I work for the French eHealth Agency, Agence du numérique en santé, and I belong to the ANS interoperability team. So the French eHealth Agency is a national agency from the Ministry of Health in France. We have three missions, and we first regulate eHealth. And in this mission, we have a mission on interoperability. We also operate some system. I will go in details further. And we promote and valorize eHealth. My speech is in 4 time. After the short introduction, I will explain what we have in France and the latest development. We will have a look about interoperability in France and some national plan to deploy interoperability. So the first introduction. France, we have a very centralized system. I mean by centralized, most of things is very centralized. So we have national system. I will explain later. We have also a national insurance system. We have also a national directory of healthcare professional. So it's a very centralized country, and it's more easy sometimes to deploy eHealth. France and eHealth. 10 years ago, we built a national system called DMP. It's a personal healthcare record, and a personal healthcare record based on a XDS repository of CDA document. And we had, 4 years after, a mailing system for healthcare professional called MS Santé. We have also national plans centralized to hospital, and we have national system also for security, like professional card for every medical doctors, for every nurse, and we have also a national health insurance card. So a very centralized system. So we begin with this, like many countries, I think. With a centralized repository of CDA document based on XDS repository called DMP. It's a personal healthcare record, and we have more than 200 professional software compliant with this system. And we had 4 years after a secure email system, and everything is based on IHE profile, IHE XDS, or IHE ZM. But on the left, you see the number of CDA documents in this repository. No use. Quite no use. So, what to do to have a better use of this system? Of course, work more closely with health professionals, more closely also with vendors, more closely with IHE. So, interoperability in France, what we adopt interoperability just to have this, to have this is a true example, for example, of treatment of laboratory data on its system who parse CDA document and CDA document using Loing, so we can have some alert, for example, on the top of the screen. You can see that you have here so on the top of the screen you have here some alert on red. You can also plot graph. You can compare also some result of biology for the patient. This is a true screen of a national component who parse CDA documents from biology. This is what we can do with interoperability. We are two main actors in France for interoperability. Interop Santé in the next session will represent IHE on health level 7 in France. And we are ANS, we are the French health agency, and we are member of IHE health level 7 at the international and also as a national level. What we provide a profile. Most profiles are dependent from IHE international profile. We also provide support, and everything we build in our national system is based on IHE. We also provide a terminology, and also we have a multi-terminology server in France. We have a national terminology management system, and we provide also support, especially with Loink, and we are now adopting SNOMED City. We also provide a interoperability testing platform based on Gazelle, of course. We use IHE profile, one of the best choices is Gazelle. And we also provide certification for vendors. And that's our last development, certification for vendors. So we begin in 2009 by the writing profile for essentially for the XDS repository, for the DMP. We had 4 years ago a terminology server, and 4 years ago also a testing platform. And now we are in the we are adding certification program called Ségur de la Santé in 3 years ago. I will not go in detail, but we have an interoperability framework in France, and this will be mandatory for some profile. Most of the profile are based on IHE. For the terminology, I think like many countries, we had a problem because we have a lot of terminology. ICD terminology for procedure, terminology for medico-social, terminology for Loink, and we had now SNOMED City. We have many terminologies, so we would like to have an access centralized point for terminology and value set. The idea is to have a national terminology server who can publish terminology, who can manage terminology, and can also link terminology between them. And with this national terminology server, we have a national contact point. The idea is this organization will manage a terminology server, and in this server, you will see after, we had Loink, SNOMED City now. Not yet, but in a few days. Value set for interoperability. We are also a collaboration center for WHO. We publish ICD-11, and we have a French drug regulation, referential, sorry. We are working with Unicom on this subject. We publish also mapping on this terminology. This is what we publish actually in the terminology server. We choose to use a semantic framework using all to publish a terminology. So this is what you can see on the left. So you can download all the terminology in all. We have also a Sparkle endpoint, and we have also a website where you can find all your terminology. And we add this week fire terminology service using health level 7 fire. We have the first result of this terminology. We have 23 terminology in France, quite big, quite huge. Why? Because we choose to add also terminology for billing. Not only terminology for interoperability, but terminology for billing. We have more than 10,000 downloads during 6 months. I will not go in detail. And what are new in terminology especially is that we are now adopting Summit City. We will see in the contract sooner. So we will have a NRC like most countries in Europe. We have also a drug referential, and we add a fire terminology service in our national terminology server. We will discuss on this topic today at French Interoperability Day at 5. There was a big national plan in France for in 2022. The idea is to spread the testing of IHE profile, testing of French profile. So we adopt the Gazelle platform to have more and more tests in France. The idea is to publish some tests in a free access. We also have a national project-a-thon for 3 days each year now, and we have also a certification process. Some result. This is a number of tests monthly for 3 years during summer. So from July to September for this year, last year, and 2021. So we can see that the number of tests was quite low by month. But with the first step of the certification procedure, we have a big increase. And we are now adopting the second stage, and we have also a big increase. So that's the effect of a certification process. And we are also a big, huge amount of tests now by month. And we have also more and more participants in the French Connect-a-thon. Maybe you see in the atrium just down there. There is a project-a-thon during 3 days, sorry. 45 vendors, 2,020 people. We have many scenarios. It's an hybrid mode, and we begin project-a-thon only in 4 years ago here in Rennes. So I think it's quite a big success. There are also a good satisfaction of the vendors, and each year we have more and more vendors. What we have done is in interoperability is also to have a certification process. This certification is the idea of this certification. We have what we call core referential on the left. Core referential, I mean interoperability referential, security referential, functional also referential, and we mix them by use case, and the vendors could have a certification process and a certification referential if they want. So we have a big national plan called Ségur de la Santé. This is the first stage of this plan, and I show you all the domain from pharmacy to medico-social, radiology, laboratory, and this is what we have done and what we are testing during this certification. As you see, we are testing many IHE profile. We have also use of CDA, many use of CDA document because our national system is based on CDA, and we're also using FHIR for the new use case. So a big and quite huge work to certify all these vendors and all these profile. This is the result of the certification. So we have two testing platforms. We have a platform for vendor training, so it's open, and you see the result. And in March we had a national projectathon, so you can see the effect of the projectathon, quite huge number of tests. And we have also a certification process with another platform, more secure, not open, and you can see the effect of the certification process. It was in September of the last year. What we try to do during this certification process and during the projectathon also is to provide support, more and more support to the vendors. So we would like to evaluate to approach. So we made a survey. This is a result of the survey, quite huge of few answers, but we had a very good score. Many vendors think that projectathon was useful. Webinar also were useful, sorry, and they want to have more validators to improve integration, to continue the webinar, and to improve operating procedure. So this is what we have done for interoperability, and I will show you the result. Yes, of course. Alors, no, it's open, but it's funded by European funds. No, it's not required by law. Not yet. We are thinking. The idea also is to add some other component to our CDA repository, and this is the component. So we had, as you see on the last slide, we have a CDA repository of documents, especially for professional, and we had another national software called Mon Espace Santé, and Mon Espace Santé is dedicated for patients, and especially what we want to exchange, and we want to connect to patient software, not only to professional software, but also to patient software. We would like to provide access to the CDA document for patient, and it's based on the IHE-MHD profile. We have also a FHIR repository to provide an access to vital sign using IHE-PU profile, and we also exchange a schedule of the patient using a national FHIR profile. Of course, in this space, we have also a CDA viewer, a website with a CDA viewer, and we have also personal record. So to deploy, yes?
Do you have like a national patient's account?
Not yet. So the idea is to have not only a national system for professional, but also for patient. And to deploy this, we have a certification program called Ségur du Numérique with a funding of 2 billion euros from European recovery. The idea is to have more more and more CDA document in the DMP. I will not go in detail, but this plan is quite similar as meaningful use in the US. The idea is to have funding for the vendors, but also for professionals and also for hospitals. So what are the schedule of this plan? The first year was dedicated only on the building trust with ecosystem, and it's quite complicated. I don't know in other countries, but in France it's complicated, and especially with ecosystem, I mean, with vendors, but also with professionals. We construct the first certification process. It's written in stage 1 with a short build, because we had most of the system already built, with also with a software certification after, and a software deployment. And I have the last result of this first stage. These results are now public. It's public. It was published by the Ministry of Health the last week. So it's quite. We have 66 million users of Mon Espace Santé, but only few are active, less than 10 million. So quite few are still, few are active. But we have more and more new user each month, and we have more and more download of our application, mobile application. So we hope to have an increase of the use of Mon Espace Santé. By Mon Espace Santé, also more use also of the DMP, of the CDA repository of document. And this is the result, the number of CDA document in the DMP. As you see, we can clearly see the effect of the certification process. And this is a result of the first certification process. I will not go in detail, but from the left, we have the result for the laboratory system, and you see it's quite low. And for the other domain, I think it's quite high. And do you know why? What's the problem for the laboratory system? Do you have an idea? No, we have 6 vendors actually in France for the laboratory system. We have problem to deploy LOINC, the terminology LOINC. It's very hard for us to deploy. I don't know in other countries, but it's very hard to deploy, especially for laboratory system to map in their system between the old catalog and the new catalog in LOINC. It's not very easy. And we have a big problem on that. So that explains the low result of the laboratory certification in France. I will not go in detail in this slide, of course. You will have them. I will not read also this slide. This is a speech from our biologist and radiologist also, who appreciate this national program. It was the first national program to deploy integrity in France. I will provide you also some link on what we are doing if you are interested. And I would like to thank you and to thank also all the ANS integrity team and certification team. This is the result, and thank you for your attention.
Hello? So this is for you. Thank you so much for your sharing your insights. And I think we have time for just 1 or 2 questions, if you are okay with that.
on sharing images in More Santé?
Okay. We have a national program to share imaging called Dream Project based on IHE profile. I think there is a session during the Experience Day with Charles Parizeau and Mathieu Baja. Mathieu Baja is one of the guys of the integrated team.
Any other question? Yes?
Is the full program government funded, or is it co-funded in some way?
It's co-funded by government or in the European Union.
The last question.
I saw the incredible increase of MySpace. It's for patients, I think.
It's for patient and professional. Actually, it's a report for of laboratory and a report of radiology.
Okay, and I wondered because in Holland we have also a problem, MySpace program. It's not really going off well like your chart is. And maybe there's something in the process because my son had an accident in France. And what I noticed, that we got the pictures or the images with us. So the patient is part of the process and carries the information. So the information exchange between France and Holland was via the patient. Is that the case in France, or is it directly from a practitioner to practitioner?
In France, we have a law now for more than 20 years called patient law, and patients have access to all their data, all their medical data. They have to request to the medical doctor, and they have medical doctors have to give them all the medical data, images, report, everything.
So that helps, but is it also useful for the process for the patient to function as an in-between two practititioners, or is the information flow directly from practitioner to practitioner?
Well, usually it goes practitioner to practitioner, but if you request as a patient, as a medical doctor have to give you the result.
Okay, thank you.
Well, thank you so much again. It was really
very
inspiring to hear. We have to keep time.